So I'm Gerald Denis. I'm a basic scientist interested in the tumor microenvironment. So next slide, please. So I'm going to shift directions for a second here and talk about type 2 diabetes, which, as you can see by the 2 time points in this graph, have dramatically become a worldwide problem over the last couple of decades. There's no region of the world that's unaffected, and it's being driven by macroeconomic changes related to reduced physical activity, increased caloric consumption, fast foods. The region of the world that's most seriously affected is India, which is now the type 2 diabetes capital of the world, but the United States is certainly not escaping this problem. Next slide. The reason this is a problem is that the gut microbiome of people with diabetes is dramatically altered and abnormal. And so this builds directly on what Stefano was just saying about chronic inflammation in patients. We really worry about T cells and T cell function in patients who've got type 2 diabetes. And without cancer, systemically, they're quite inflamed, often have high levels of inflammatory cytokines, and their T cells typically are exhausted, meaning that the expression of immune exhaustion markers and checkpoint markers like PD-1 or CTLA-4 are dramatically elevated both systemically and in infiltrating compartments of patients who've got type 2 diabetes. Next slide. The reason why this is important in cancer is shown here. This is an anecdotal report here of work that we've been doing in collaboration with Naomi Ko at Boston Medical Center. So these are BMC patients with type 2 diabetes matched for their ER-negative tumors. So I'm showing you a flow cytometry analysis we conducted in collaboration with Anna Belkina in the flow core at BU, showing single cell events here. So each dot is an event that's captured from the breast microenvironment. So breast events are sorted to show you single live cells and then to T cell subsets. So CD3 positive cells are broken down in the bottom row here to CD4 and CD8 T cells. These are lymphocytes that are infiltrating the tumors of these women. And then on the y-axis of the lower 2 graphs is PD-1. So this is one of the classic immune exhaustion markers that's elevated in diabetes. You can see by the bar graphs here that patients who have type 2 diabetes have dramatically elevated levels of immune exhaustion. So here PD-1 expression is doubled in both CD4 and CD8 T cell subsets of the immune infiltrates of this person, comparing these 2 types of tumors. So we're currently gathering lots more cases like this, and I don't have enough data to show you statistics at the moment, but the pattern is pretty robust in its holding, so that patients with diabetes have dramatically altered immune infiltrates. And I'm just showing you here by the graph that this patient is in fact quite abnormal. So diabetes measured by HbA1c, which is glycated hemoglobin, you can see the normal range there for these values. And in this type 2 diabetes patient, it's quite a bit higher. Fasting insulin and fasting glucose are also elevated. So next slide. And so this leads to some urgent and unanswered questions. So we don't know if the classic arsenal of immune therapies, so checkpoint blockade markers like things that interfere with PD-1, work in patients who have type 2 diabetes. So a lot of these agents like Pembro and Nivo and atezolizumab that target the immune exhaustion markers on their T cells were run in clinical trials in patients who don't have cardiometabolic disease or diabetes or heart disease or whatever. So this is really a huge oversight. The problem is that cancer centers, both in all over the world, are looking to American and European and other centers for guidance for how to use these immune checkpoint inhibitors. But the patients that they've been selected for these clinical trials typically don't include people with these diagnoses. And so the argument is that the immunology and microbiome of most of the cancer patients in the world is not sufficiently understood. And we don't know if the results of clinical trials from patients in US academic medical centers are really going to apply all over the world where diabetes is so prevalent. And so this keeps me awake at night. Thanks.